and by means of this delayed tape-recorded broadcast, it's our pleasure to interview Dr. W. Baum of Salem, Oregon, a member of the Oregon State Medical Society Committee on Public Relations. Dr. Baum was the featured speaker at the annual banquet of the Eastern Oregon District Medical Society meeting held here in Baker yesterday and today. His subject, the outlook for American medicine, touches rather closely to the non-professional side of the medical practice, and we prevailed on him to summarize some of the main points of his talk for this ensuing interview. First of all, Dr. Baum, we'd like to express through you to all the physicians in attendance a hearty welcome to Baker, and we certainly hope your visit has been and will be a most pleasant one.
Well, Mr. Simmons, my visit has certainly been a most pleasant one. The people of Baker that I have met have gone out of their way to do little things for us, to help us, and you've even provided us with perfect weather for the meeting.
Well, Doctor, realizing that our time is limited now for such an all-important subject, I'd like to begin by asking just what is involved in the outlook for American medicine.
We may divide the practice of medicine into two phases or two parts. First, the scientific side, which consists of the expert diagnosis and treatment of disease. American doctors lead the world in this phase of medicine. The reason, of course, is constant study. The doctor spends 8 to 11 years in preparation, and following his medical school days, all of them have frequent attendance at medical society meetings such as this one, where they listen to lectures and exchange ideas. However, that phase of the practice of medicine is not the subject of my discussion. The subject of my discussion in the outlook for American medicine is the outlook for American medicine on the side of social, political, and economic activities. This phase deals with the problem of how to get this expert medical service delivered to our patients. Now, this second phase of medicine is also studied by the doctors at meetings like this meeting of the Eastern Oregon District Medical Society. The doctors spend all day discussing scientific matters and then sit up half the night discussing the economic problems. You might ask me, Mr. Simmons, why is it necessary for the doctors to study the social and political and economic side of the practice of medicine? And I might say that we wish we didn't have to. We wish we could have only private practice of medicine. I mean by that the individual private practice of medicine where you as a patient go to visit your doctor, receive the service which you need, and pay his fee. This individual private practice of medicine provides the highest quality of medical care which has ever been seen under any system. It's the most efficient of any system, and it is the most economical of any system which has ever been devised. Under this system of the private practice of medicine, the total cost of medical care is not great. But you and I and everyone listening to this broadcast realize that people are frequently faced with a catastrophic or serious illness in which very high drug bills, very high hospital bills, and high doctor bills may seriously interfere with the economic life of the family. So that the people of this country desire some method of spreading the cost of medical care to protect them against the catastrophe which I have outlined, and they desire to be assured that the distribution of medical care will be proper so that some or many areas are not left with too little.
Well, I rather imagine that much of the material you've just mentioned is somewhat of a revelation to most of the general public, and I feel sure I'd be asking the question uppermost in the minds of our listeners when I ask you, what is the medical profession doing about this new phase of social and economic obligations?
The doctors, of course, cannot give you any hard and fast set program at this time. This is a matter which involves experimentation. We must go slowly, and we must work out one problem after another as we go along in order to arrive at a solution which will give the people of the United States the very highest quality of medical care and give it to them in a form which will make it safe for their economic life and protect them against the possibility of what we might call a medical economic catastrophe. Now, I can envision a program which consists, which we might discuss under three headings. First, we would speak of the education of the public. It's necessary that the public be educated in these medical matters because they must know what they can do, what they cannot do, what they can have, and what they cannot have without sacrificing the all-important thing of quality of medical care. It is now necessary and will always be necessary for the people to provide self-care for minor illnesses. It is impossible to have enough doctors to provide care for every little type of cut, bruise, cold, or what have you. And if we did have enough doctors and they spent all their time or a large proportion of their time on such care, they wouldn't be much good for the more important things. The public, the people, our patients must know when to call the doctor, when it is unnecessary to call the doctor. They must know how to follow the doctor's advice intelligently. We must, in some manner, teach them to know their own bodies, how the body is constructed and how it works. If you take your car to the garage and it doesn't run well and you ask the garage man why, and he says it's because the carburetor is scraping on the transmission and therefore the wheels don't turn smoothly, you know that that answer is ridiculous because you have pretty good knowledge of how your automobile works. But if you come to me as an eye specialist and say that you don't see well out of your left eye, and I say that the lens is scraping against the retina and interfering with the circulation of the aqueous fluid, you might accept that as a perfectly logical explanation of your trouble. As a matter of fact, it's just as ridiculous as the illustration I just gave you about the automobile. Now, this education of the public should and is in Oregon starting in the public schools. Oregon has a very advanced system of health education in the schools. It could be carried on by doctors talking more frequently than they do now before service clubs, women's organizations, about things which pertain to your body and its functions and how it works, and illness and disease and health. We must also educate the public in the economic side of the practice of medicine so that they will realize that it is very difficult to fit medical practice into an insurance scheme, that it is impossible to fit total or complete medical coverage into an insurance scheme and have it pay out, but that we think we can fit the important or major illnesses into an insurance scheme. More about that later. Now, the second part of my program would be this. I feel that it will be necessary for the doctors to participate more actively in political matters than they have in the past. I mean by that the doctors should make themselves available to our legislators when these legislators want advice pertaining to medical subjects. This is necessary to head off some of our starry-eyed dreamers who think that you can fix anything by just passing a law. These people are in a great hurry to solve all problems right now, and most of these laws which have been presented would only make things worse. They would result in the American people paying in a total more for their medical service and obtaining a lower quality of medical service, and would not at all satisfactorily solve the economic problems of the practice of medicine. And then the third phase of the program which I would suggest is, of course, the active one, and I've referred to it here before, where the medical profession will work out some plans for prepaid medical care. plans which will be operated by the doctor and by the people or their patients, and they'll be operated for the benefit of the doctors and for the benefit of the people and their patients. It must be a cooperative sort of venture, because, as I stated before, it is difficult or almost impossible to fit medical practice into insurance schemes. I do not have time here to go into the reasons for that and to discuss the natural economic laws which govern insurance. But I can assure you that it is true. So that we're faced with a very difficult problem, and it will require the active cooperation of the public and the active cooperation of the doctors to make it work. Here in Oregon, we have Oregon Physician Service, which we call OPS, which has been designed for that purpose. This plan is not perfect yet, but it gives an opportunity for the doctors and the people to experiment and work together toward a satisfactory solution, which we believe will probably be some form of voluntary prepaid medicine.
Well, it's regrettable that time will not permit us more detailed discussion on this very interesting topic, but I'm afraid for now we'll have to stop and hope that sometime in the future we can get more information about this sort of thing.